And
I'm Sabrina.
and today we'll be talking about alcohol for the Dr. Bill Show. Thank you.
Work in the brain and how does it affect the body?
First of all, alcohol can affect the brain and body in many different ways, depending on several factors such as gender, age, drinking history, and family history. Also, drinking alcohol often can result in alcoholism, which is a dependency on alcohol. At a small dosages, alcohol can induce relaxation and slightly improve an adult's speed of reaction. Unfortunately, the body can only break down alcohol at a slow rate, and large amounts consumed in a short time period overtax the central nervous system. As the concentration, alcohol is a depressant, and depressants affect the brain in facilitating neurocommunication sympathies that use the neurotransmitter GABA in your body, increases cognitively receptacle and motor processes begin to rapidly to decelerate. And the second question for Sabrina is, how does the drug tolerance work?
Heavy consumption of alcohol is a huge problem in the United States. Physical dependency, tolerance, and addiction all develop with prolonged heavy drinking. Drug tolerance is when over time you can drink more than when you first started. If a person drinks in the same environment all the time, there can also be an environment intolerance. There is an experiment done on rats where the conductor purposely overdosed rats on heroin, but only 60% compared to 32% died in the sugar cage because of the environmental tolerance. Luis, our third question you're answering is, what are some evidence-based treatments for this particular addiction?
Couple of types of treatments. The first treatment is behavior treatments. They are aimed at changing drinking behavior throughout counseling. 3 medications are currently approved in the U.S. to help stop or reduce drinking and prevent relapse. The medication is usually combined with behavioral treatment. There are also mutual support groups like AAA. It is a 12-step program in which it appears to reduce addiction and relapse. The info is from National. Okay. There we
go.
Well, Molly, there are a couple of types of treatments. The first treatment is behavioral treatments. They are aimed at changing drinking behavior, counseling. There are a couple of types of treatments. The first treatment is behavioral treatments. They are aimed at changing the drinking behavior throughout counseling. 3 medications are currently approved in the U.S. to help stop or reduce drinking and prevent relapse. The medication is usually combined with behavioral treatment. There are also mutual support groups like AAA. It is a 12-step program with peers to reduce addiction and relapse. The last question for Molly is, explain for why the addiction may be resistant to treatment and change. In other words, why is addiction so strong?
Okay, talk about that. Why this addiction is so strong. I think drug addiction is so strong because of classical conditioning and operant conditioning. As I mentioned earlier, environment impacts tolerance, and it also impacts why addiction is so strong. Operant conditioning operates on environment. Classical conditioning is for learning specific behavior, which in this case will be the strong addiction.
Well, I think that's a wrap. Hope our answers are helpful for the Dr. Bill Show. Bye.
Bye.